The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
I hit my arm on the side of the dryer, and it gave me a terrible burn.
Accidents, surgeries, burns. They leave unsightly scars, but now there may be a way to help them disappear without surgery or drugs. Discover the latest weapons in the unwanted hair war. See why your home can be a good place to get well. And find out why we now may be able to spot osteoporosis before we end up in a cast.
I really didn't know how bad it could be.
Parkinson's disease. Are there any new breakthroughs? All this and more today on Today's Health. This program is brought to you in part by IHS Home Care, Cynosure, Somerset Pharmaceuticals, Metra Biosystems, and by an educational grant from MERS Skincare Products.
What's the secret to staying healthy? Some experts say it's diet and exercise. Others claim a positive mental outlook can help you avoid illness. While there's probably no one secret, there are many positive things you can do to help keep your mind and body healthy. Hello, I'm Faith Daniels, and this is Today's Health. Illnesses, surgery, and accidents can often leave us with unwanted scars. Some innovative technology, however, may help make them a lot less apparent.
I received my scar by helping my sister at the laundromat. For some reason, that dryer had conducted and caused it to be extremely hot, and I hit my arm on the side of the dryer, and it gave me a terrible burn.
Here they find out I have to have a 4-way bypass done. I had the 4 valves stopped up. And I went to the surgery, come out of the surgery, and I had the scar. I got one here and the one up in the front here that operated on there. And it started healing a little bit, but not that good.
A scar results when an injury to the skin goes below the outer layers into the dermis, and you have a permanent change in texture and appearance of the skin.
Scars are produced by a number of factors. It can be surgery, it can be disease, it can be mechanical forces. These are the common causes for scars.
Every year in the United States, there are 24 million surgical procedures and cesarean sections, 1.25 million burns, and nearly 38 million injury-related visits to the emergency room.
All of these events can result in unsightly scars, and these marks can be far more than skin-deep blemishes.
The scar originally was unsightly, and I had to wear different types of clothing. Like if I was going out on a date or going out for the evening with my friends, I would tend to wear long sleeve shirts even though it was in the summer.
So I'd like to go swimming, so I was going swimming. I was getting teased a little bit about, my hair didn't quite grow in. I was getting teased about the scar.
When patients have very extensive, devastating scars, aggressive surgical intervention might be required. In the past, when I've been confronted with patients who've had problem scars that were raised and uncomfortable, I've used either silicone sheeting, silicone gel, or even injected cortisone medication right into the scar.
Some people are so concerned about their scars, they undergo cosmetic surgical procedures. But an expensive surgery isn't the only solution.
Recently, another option became available. Now, some doctors are recommending non-prescription skincare products, like Mederma, developed by MERS, to help scars appear softer and smoother.
Mederma is a recent new product brought in from Germany that has shown a considerable amount of success in reducing scars.
And I started using the Mederma twice a day on this scar, and noticed an incredible difference within months.
It's not as red, and it's less noticeable when I'm going in the water. I wouldn't hesitate at all to jump in the water without a shirt on and have somebody say to me, you don't have no scar or anything else.
It's made me so happy because now I can wear my short sleeve shirts again and not have to worry about it.
How fortunate can that individual be to know that their scar is less visible and less prominent? And I can't think of anything that would make a person happier.
Home or the hospital? Where's the best place to get well soon? And if you have hair growing where you don't want it, stay tuned. On Today's Health.
You may not realize it, but the hospital isn't the only place to recover from a serious illness. Sometimes home sweet home can provide a better environment for recovery. What do you consider when deciding on the hospital or the home?
The key challenge facing healthcare providers today is to provide the care that is needed within the parameters that have been established by the payers such as Medicare and the insurance companies. Alternatives to hospital stays became important for the consumers several years ago. And those settings include nursing facilities, outpatient clinics, and home healthcare settings. It is important for other healthcare providers to remember that patients need to be offered more than one alternative in terms of the agency that they're going to be working with.
When my doctor got through with dressing my leg, he said, maybe you could do this yourself. I got nervous about it because I think infection is the thing we had to worry about. I says I would feel more comfortable having somebody watch me do what I'm doing and see if I'm doing it the right way.
I needed wound care for my foot because for me it's hard to to clean the wound, to change the dressings, and I needed daily care from the nurses.
At home, you do better. Your loved ones are around you, your pets are around you, and psychologically, people do much better at home, and that impacts on their healing process.
In terms of cost, effective home care management could save as much as 30 to 70% versus a hospital. In terms of quality of life, the ability to be at home could be priceless to a patient.
A company like Integrated Health Services, IHS Home Care, can provide a single source for a patient's home care needs. They can even provide reimbursement specialists to help you quickly confirm insurance coverages, verify benefits, handle pre-certifications, and process all forms and filings.
Today, home health care, because there's such a huge demand for it, and now it's becoming a costlier alternative than it was in the past, is becoming a teaching mode.
You can treat any kind of medical condition really nowadays in the home health setting. We have patients that are on chemotherapy, IV antibiotics. We can treat ventilator patients.
Just overall, the well-being of the patient is so much better at home in familiar surroundings, and we become as part of the family.
I would recommend it personally to anyone that needs home health care. I would tell about it, and I've done it before.
What do you want out of life? Everyone has different goals and aspirations, and achieving them usually requires staying healthy. Now look at your habits. Are they helping you get the most out of life?
Riding the wave of the technological boom are many cosmetic treatments that only a few years ago were still in early stages of development. Some of the most routine procedures are being fine-tuned for safer, faster, and more effective patient results.
The two biggest areas for hair removal for patients would probably be, especially for women, chin hair and around the mouth, mustache area. We have a lot of patients who are interested in that. Leg hair, of course, and underarm hair, because it'd be awfully nice to not have to shave, every day.
I have sensitive skin under my arms, and after shaving, I would be raw, and my skin would get very irritated. And that's one more thing that you have to remember to take care of, wearing sleeveless shirts and bathing suits, and this was a great way to get rid of it.
Let me just take a look and see. Okay, looks good. You did fabulous, really. Other alternatives for hair removal, many are not permanent, and people can shave, but that's something they do on a daily basis in many cases. You can wax, which will last longer, but it's never permanent. Basically, you pull the hairs out and then they just regrow. Electrolysis is permanent, but it's very tedious. You have to do each individual hair follicle, and it's usually quite painful, and even though it is permanent, oftentimes people need several treatments.
Today, laser treatments have become the medical tool of choice, but the use of lasers alone may cause damaging side effects to the skin. The challenge of lasers has been to destroy the large targets in the dermis, such as a hair follicle, without damaging smaller targets, especially in the epidermal skin layer. Recently, a new technology called TKS lasing, or thermokinetic selectivity, was introduced, which can be performed with Cynosure's Photogenica LPIR laser. This new technology allows a long pulse of laser light to be sent through the skin and down into the hair follicle, removing the hair without damaging the patient's skin.
The laser hair removal with the LPIR will allow patients to permanently remove hair more quickly and painlessly.
Finding a treatment that can get rid of unwanted hair, I will start with my underarms and probably use it for my legs. I've noticed hair on the top of my toes that I'd love to get rid of, and I think this could be unending. The thought of never having to shave again is wonderful.
If you have any questions about any issue that concerns your health and well-being, you can probably find the answer on the internet. In fact, our Today's Health website at www.vstar.com is loaded with information and links to other in-depth health sites. So log on and get the answers you're looking for. You may sometimes see an older person shaking for no apparent reason. It may be due to a neurological disorder called Parkinson's disease. The first reports of this disorder date all the way back to 5000 BC. Although modern medicine still has no cure, every day we're learning more about it.
They appear to be constantly trembling or shaking. Sometimes they speak in a soft voice. You may know someone like this. You may be one yourself. About 1 million people in the United States suffer from Parkinson's disease. And as the population grows older, this figure is expected to get larger. Parkinson's disease is a common progressive neurological disorder that results from the degeneration of neurons in a region of the brain that controls movement. The degeneration causes a shortage of the brain signaling chemical called dopamine, which leads to impaired movement.
The symptoms of Parkinson's disease include the tremor, the postural instability, and the difficulty with coordination of movement. It's the slowing of movement, in fact. And this is something that you see with normal aging. But as the symptoms of Parkinsonism become worse, then people become incapacitated by the disorder, and that leads them to be seen by neurologists.
When I first found out about Parkinson's, I didn't know too much about it. And I really didn't know how bad it could be. It's easy for me to just get up and start walking. And I can walk a few steps, but they don't want me to do that because that's when I fall.
The average onset of Parkinson's disease occurs around the age of 60. However, 1/3 of the population develops symptoms before they reach 50. Due to this, early treatment becomes extremely important.
It's unclear what causes Parkinson's disease, but scientists have been looking at a number of different factors, including genes and the environment. We now know that people who have a family member afflicted with Parkinson's disease have twice the risk of coming down with the disorder. In addition, scientists have been hot on the trail of looking for things in our environment which can be linked to the development of Parkinsonism. These include pesticides and heavy metals. So individuals that have been exposed either to well water or have been in agricultural types of industries tend to be at a little bit higher risk for the development.
I'm doing more things than I used to do, but I'm being also more careful than I used to be.
Although there is no cure for Parkinson's disease, there are treatments, including medication and in some cases surgery. As our understanding of this disorder grows, so do the treatment options that are becoming available.
The The 90s have come to be known as the decade of the brain. Our growing understanding has already led to many breakthroughs in treating neurological diseases and has also been the source of some innovative treatments for people with Parkinson's disease.
For people with Parkinson's disease, there's a great deal of hope, even if there is no cure. There are several pharmacological agents that doctors can use to help control and manage the symptoms. Many patients are only mildly affected by the symptoms of this disorder, which can be easily controlled for many years after diagnosis. However, in the later stages of the disease, patients' symptoms can become severe and very intrusive. One of the most common treatment therapies is a prescription called levodopa.
Levodopa is converted by the body and the brain into dopamine, and then the dopamine is replaced in the brain, and remarkably enough, replacing the dopamine improves the symptoms of Parkinson's disease.
After you've been on it a long time and you have to increase the strength, you end up with a lot of side effects. I don't have very many side effects now because I'm on a low dosage.
Researchers have identified another compound, selegiline hydrochloride, or Eldepril.
The first visit, when she diagnosed me that day, she felt pretty sure that I had Parkinson's, and she immediately started me on Eldepril.
Chemical name for Eldepril is selegiline, is what's called an MAO inhibitor. An MAO inhibitor inhibits a certain enzyme in the brain. This particular enzyme that is inhibited by Eldepril breaks down dopamine, so that if you inhibit it, you have more dopamine in the brain. So the use of Eldepril can be a boost to the administration of levodopa.
Even though I have Parkinson's disease now, I am still quite active, and it amazes people when they see me all around the building when I go by myself.
Every now and then I have to pinch myself and remember that I have Parkinson's. I will still tire more easily, and there's some tasks that I may have more difficulty doing than other people. But as you grow older, things like that are normal and they happen.
There is no cure as of yet for Parkinson's disease. That's why companies like Somerset Pharmaceuticals are continuing to fund a massive research effort to understand this baffling disorder and eventually find a cure.
I feel very proud that I manage as well as I do.
Growing older is tough enough without having a disorder like Parkinson's disease challenge you. Fortunately, there is help, support, and most important, hope.
Your bones may be getting more brittle, and you may not even know it.
I found out I had osteoporosis after I fell off a ladder.
Osteoporosis, a silent disease with few detectable symptoms. Now there may be a way to detect osteoporosis before it becomes dangerous. Up next on Today's Health.
Osteoporosis is a big word for a challenging disease. It's a condition where the bone tissue is reduced and the likelihood of a fracture increases. Women in their postmenopausal years are at the greatest risk for this disease, but some new detection techniques may help them get treatment before they ever break a bone.
This year, as many as 1.5 million Americans will have a bone fracture due to osteoporosis. The damage from this disease costs this nation nearly $10 billion a year and forces many people into situations where they need long-term assistance. Osteoporosis is a condition where the bone tissue is reduced, which increases the possibility of a fracture. Hip fractures are especially dangerous and often result in long-term disability.
Osteoporosis is a disease characterized by weak bones that can lead to increased susceptibility for fractures.
Women are about 4 times more likely to develop osteoporosis than men.
I found out I had osteoporosis after I fell off a ladder and suffered a compression fracture in my upper spine. It didn't really affect me that much, but it concerned me because my mother has osteoporosis, and it made me nervous.
The people that are at greatest risk for osteoporosis throughout the world are postmenopausal women, women who have gone through the menopause, particularly those women who are not on treatment to prevent calcium loss from the skeleton. The detection of osteoporosis is best done by measurement of bone mineral content, bone calcium content, by some new biochemical markers.
Biochemical markers are substances like hormones, collagen, glucose, or other chemicals that can be found in our blood, urine, or other samples from the body. For instance, the diagnostic test for bone turnover or metabolism, called Pyralinx D, is a urine test.
If one of the biochemical markers are high, there are abundant studies now that show that these high markers indicate that that individual is losing bone rapidly. Rapid loss means higher risk for fracture at earlier stages in life, and it also is a compelling argument for more early intervention with estrogen or some other medication.
My outlook for the future is good. I don't feel handicapped by knowing I have osteoporosis at all. And I also realize that knowing about it now is the best thing that could have happened to me. Knowing about it 20 years from now, when my bone is much more brittle, would have been much more devastating to me.
Prevention is always better than treatment. Hopefully, innovative diagnostic tests will help us react early and prevent the progression of a dangerous new disease.
The average person is expected to live about 78 years, but that can seem like a miracle when we read all about the illnesses that can damage our health. Fortunately, there are many ways to avoid the negatives and embrace the positive things that can help us stay well. I'm Faith Daniels. If you want more information about anything we've covered on the show today, visit our website at www.vstar.com. And join us again next time as we get right to the heart of matters concerning your life on Today's Health.
To purchase a complete written transcript or a videotaped copy of this or any edition of Today's Health, write to this address or call 1-800-877-7769.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.